For those tuning in for the first time, the HQ is a podcast serial produced by CHA Learning. CHA Learning is the professional development division of Healthcare Can and is uniquely Canada's only fully online learning provider serving all of healthcare. So please check out more about our learning programs and services after this episode and discover how we collaborate with health leaders and organizations to empower healthcare professionals with the knowledge, skills, and relationships to impact health system improvement. Hi, I'm Dale Sherbeck, and welcome to the HQ podcast, where we dive into healthcare issues and topics from the perspective of its people and discuss them with those that are leading and impacting the health system. Together, we'll explore these topics as we continue to learn together. Today, we're going to discuss a topic that is core to my organization. For those listeners who may be new to the work of Healthcare Can, we are the national voice of hospitals, health authorities, health research institutes, and healthcare organizations across Canada. Healthcare Can advocates for health research and innovation and high-quality health services for people across Canada, two issues that are intrinsically linked. So I thought maybe it's time for the HQ to discuss this more explicitly and explicitly why this is important and important to us all. Historically, Canada has always punched well above its weight when it comes to competing on the world health research stage, a result of great minds working in excellent facilities supported by government and philanthropic funding. And we have produced some amazing work and results that have benefited billions of people. But we know research and development is now very much a global field, so it may concern many that government funding for health research has not kept pace with many of Canada's OECD peer nations or inflation itself. So today's conversation is ultimately about why does any of this matter? What in fact is the role of health research in Canada, and what difference does it make, and what is the impact of this funding gap on healthcare, its people, and Canadians? Today, we are very pleased to be joined by Dr. David Hill, Ellen Chesney, and Cindy Triton, three leaders who are integrally involved in Canada's health research community. David is the Integrated Vice President, Research and Scientific Director of Lawson Health Research Institute at St. Joseph's Healthcare and London Health Sciences Centre and Professor at Western University. Ellen is the Chief Administration Officer, Research at the Provincial Health Services Authority in British Columbia, a $190 million research enterprise. She manages board governance and oversight and research across the PHSA research enterprise, which includes 5 research institutes. And Cindy is Director of Research at Island Health Authority in BC, where at any one time 30 to 40 clinical trials are taking place at the Royal Jubilee, Victoria General, and Nanaimo hospitals. Cindy has particular expertise and interest in advancing research in emerging health research institutes in BC and Canada. So hi, Ellen and Cindy and David, and welcome to the HQ, and thank you for joining us to have this conversation about health research in Canada and why we as a nation need to better understand its value and why we need to ensure it's getting greater support.
Thanks, Dale.
Great. Good morning, and thanks very much, Dale.
So Ellen, maybe we can first start with you. What is the role of health research in Canada's health research ecosystem? I mean, why are we having this conversation in healthcare, and why aren't I having this conversation with, let's say, the universities of Canada?
That's a really good question, because the role of the health system in research is completely pivotal, fundamental to the health of the health research ecosystem. So there are what we call research hospitals, and these are kind of like today's version of what were the old teaching hospitals. But they're the organizations, the health organizations that deliver highly specialized care, also conduct research, and also play a pivotal role in training the health science students coming into the system. So they provide them with that clinical placement, that clinical training that those students require. And it is the integration of those roles that actually delivers great care to Canadians, because you're learning new discoveries, you're applying them into the health system, and you're actually training the people who are going to deliver that care in the future. So it's really critical. And I find a lot of people are actually confused about that and think that research is really the purview of universities. But in fact, I like to kind of give them the example of British Columbia, where if you look at the University of British Columbia, a very research-intensive university, fully half of the research that's conducted at UBC is health research. And then if you look at that health research, about 80% of that is actually conducted on health authority research institute sites. So it is a very close partnership between the health system and the academic system. And it is that involvement of patients and people who really understand the issues arising at the bedside that is pivotal to the health research system.
Thanks, Ellen. That's really good context. So maybe Cindy, if building on that a little bit more, maybe demystifying like what is health research itself? I mean, do we all have the same understanding of what we're even talking about? And, what are maybe some surprises that you could share with us about what that might be?
Great, thank you. That's another great question. So first of all, if we just contextualize research, so research at a very fundamental level is a way to ask and answer questions following methods that reduce bias and produce knowledge. So in health research, that knowledge is then used to advance development of new ways to diagnose and treat disease, or inform policies and practices to include health of the population or health services. And in some cases, that research is essential to inform further research as well. So health research is very broad in scope. It includes the critically important research that happens in biomedical labs. It includes clinical research that involve people. So an example here would be clinical trials. It involves health services and systems research and population health research.
So it's not just about dissecting things or splitting molecules or drugs and things like that.
Absolutely not. It's a continuum. And thinking about public health research in particular, that's research that seeks to improve the health of the entire population and to importantly reduce inequities between different population groups. And some of the examples are quite profound if we just park there for a moment. Like let's look at cancer. So cancer is the leading cause of death in Canada. And about 2 in 5 of us will be diagnosed with cancer in our lives. But public health research in particular has surfaced, and cancer touches many areas of that research spectrum. But public health research has surfaced what the major risk factors are for cancer and which ones are under our control, like not smoking, something we know very well now, diet, exercise, reducing exposure to hazardous fumes. This research generates evidence, that kind of research, the public health research generates evidence to support government policies like taxation or warning labels, or recommendations for exercise and diets as part of prescriptions that we get from doctors to stay healthy.
Thanks, Cindy. So maybe, David, if I could just turn my attention to you and anything that you might want to add to what Cindy's been sharing on that, and and maybe further help build the context in terms of, what difference does this make to patients, and how long does it take to see some of this research sort of find its way into our lives and make an impact?
Well, as Cindy said, there's all sorts of different types of research. There's perhaps the most obvious type that people would recognize is clinical trials, where patients can participate in the study of the effectiveness of new drugs and or medical devices. And then there's literally thousands of clinical trials going on in Canada at any one time, almost all through research-intensive hospitals. And it might be a diabetes drug, a new development there, or it could be a new design of joint replacement. And quite often, even after that clinical trial actually gets published and reported, it can take years for the provinces and territories to actually take that in as part of their funded care. And so having clinical trials available for patients gives them access to the very latest developments and technologies that are coming out worldwide and getting them to Canadian patients before our ministries of health actually get round to including those in the formulary going forward. But not all research, as Cindy said, is about drugs and devices. It can be health systems research. How can we better deploy our health research staff or health staff to make sure that patients get timely care, Or how do we build the staffing around a new technological innovation like AI, for instance? And there's a lot of community-based research. So, one example that I'm really proud of from our own community here in London, Ontario, is research around the discharge of patients from our mental health care facility. Patients who had to be admitted for a period of time. And when they're ready for discharge, it can often be really difficult for them to cope with life back in the community. And there's a risk of them rapidly becoming homeless. Unfortunately, they're prey to criminals out there as well when they leave the institution. And they certainly can get rapidly out of touch with any healthcare support that's ongoing. So, our hospital here, St. Joseph's Healthcare in London, created a plan whereby no patient would ever be discharged to homelessness. And this entailed pre-planning with the city to arrange a choice of public housing units that were convenient for the individual patients, where family and friends could be available to provide support. Arrangements were made with the benefits staff in the city to make sure that rent and other costs were handled on behalf of the tenants, and that health providers knew exactly where they were, so that if the patient needed to reach out for additional health support, it could be provided quickly. So this combination of community-based research really dramatically reduced the readmission rate of patients back into mental health care, and huge client satisfaction as a result of this research program. And I was really proud to see that this model was then adopted by other health authorities around the world and is now the model adapted, for instance, by the National Health Service Scotland. So research is wherever you look, and it should be wherever you look within our health system.
Can I just jump on that just briefly, Dale, because
Sure.
David made that point around clinical trials, giving patients access to care. And I mean, an example that people just aren't even aware of, the BC Children's Hospital is part of our organization and treats every child in the province of BC who has cancer. Basically, every single child with cancer who's being treated at Children's Hospital is on a clinical trial in order to access new treatments, new drugs, et cetera. So we have increasingly started talking about the term research is care and care is research. And that is why they are completely linked. So we only get really great care when we do have really great research.
That was well said, Ellen. And if I can add something as well, COVID-19 was a great example of exactly that research is care. We were faced with a novel virus. We had a little understanding about the virus at the beginning, and we really had no effective treatments. The most effective treatments globally started to become available very rapidly through only clinical trials. And what that meant is that our health system was responsible for providing clinical trials as a treatment option as much as we could throughout the Canadian health system, so that people coming in for care that were hospitalized had an option to either go with standard of care or to become part of those clinical trials. And the interesting thing with the clinical trials is because the world was collaborating, we rapidly saw what was working and what wasn't. So the protocols would change. So the best therapies were constantly under study, accelerating the movement of the best innovations to treat COVID-19 possible to patient care. And without that capacity in our hospitals, not only in the large hospitals or the research intensive hospitals, but at our community hospitals. For example, in Nanaimo on Vancouver Island, it's not a large center, but we were able to offer collectively between Victoria and Nanaimo, all patients that were hospitalized with COVID-19, the opportunity to participate in a clinical trial.
Well, so you've built a very compelling case in terms of, what is research or health research and why it's important. Each of you have, however, given me a bit of a segue in terms of my more controversial question that's going to come here. And I don't mean to put any of you on the hot seat, but I'm going to do so anyways. Because I think it is part of the burning question. I think as you've even described, David, about how the research that you did found its way into Scotland and other places around the globe. really, why is it important that Canada leads in this way? If health research is a global endeavor and something that we can all benefit from, regardless of where it's going to be conducted, why does health research need to be so integrally invested in our own country?
Okay, well, I can lead off if you like on that, Dale.
Yeah.
So, yes, it's very important that we innovate, that we then export best practices by example to the rest of the world. And similarly, Canada is not the sole repository of knowledge, and best practice that's developed elsewhere in the world, we need to take advantage of and implement into our health systems. So, health research is a team sport, a global team sport based on sharing of the best information available. At many institutions, it's not just clinical trials, but actually discovery-based research that goes on. And there are real benefits in being involved as a nation in discovery research, and using cells and tissues to look at the processes of generation of disease. What goes wrong in the cells that actually results in a disease state. And quite often that type of research, results in discoveries that we can patent, create intellectual property, and then take forward in partnership with industry to develop new families of drugs that can then be taken into patient studies through clinical trials. And this discovery pipeline, can involve the formation of new companies. It can generate royalty streams, and the income from that commercialization activity can be plowed right back into research, either into discovery or into new innovative clinical trials to do pilot studies. So really, research in Canada is a self-funding business plan to a large extent. Yes, we enjoy support from the federal government, provincial governments, and other important stakeholders, but to a certain extent, we generate our own research money as well through commercialization.
And can I just add on to that as well? Because David's done a
Yes.
fantastic job of talking about the biomedical research and
Mhm.
the role it plays as an economic driver. Again, on that clinical side of things, like sometimes there isn't a really strong awareness that the people who actually provide the most highly specialized care are also often clinical researchers. And so they will go and stay where the fullness of their career, both their care and their research, can be supported. And so often you may have a situation where a highly specialized clinical program is really dependent on like maybe one or two highly specialized providers. And if the research activities of those people are not supported, they will not stay. And that can mean the loss of an entire program, an entire clinical program for a province, requiring governments to actually pay patients to go out of country sometimes for care and that sort of thing. So being a leader is critical because it gets back to one of the other things we know through research is that where you have research intensive care, you have way better outcomes. So bottom line is if we want our population to have the best health outcomes, we need to do really good, strong research.
Absolutely, Ellen. I can't emphasize strong enough how I have seen the impact of a researcher that wasn't well supported in several cases leave Canada. And what we do want, what you said was exactly right when it comes to the quality of clinical care. We want the best and the brightest clinical minds able to do research, to build on their clinical experience, advance medicine, and advance their careers here in our country, doing that work in our country, improving care locally, nationally, and through publishing their results globally. So many, many advantages to the quality of care in the health system.
So I think each of you have probably answered the next question a little bit, but I'm just we'll put it back to any of you if you'd like to be more explicit in terms of I guess the business case about why we should be making these investments in our own country in terms of its um, that it's not cheaper, I guess, to buy these innovations from others, that there are other, I guess, hidden benefits or that return on investments that we perhaps need to better quantify to demonstrate the value of why we should be making these investments in Canada. I don't know, would any of you want to sort of further comment on that?
I can start, Dale. Yes, it may well be cheaper in the short term to actually not do health research and buy your drugs off innovations from other countries. But that cost would be much more in the long term. Because if discoveries happen in Canada, then these new innovations can be assured to undergo clinical trials in Canada. Because the Canadian scientists, as the discoverers, will be leading those studies. So Canadians are the first to benefit from that research. If we don't have skin in the game, our patients will not have first access to those new innovations. But health research is a really important economic sector, quite apart from the benefit to patients.
Mm-hmm.
So I'll give you some data for Ontario, just Ontario alone. The hospital health research sector in Ontario attracts $1.8 billion into the province each year, and it employs around 25,000 people. Now, I don't know what the average number of people is that works in a car plant, for instance, but I guess it's 7,000 or 8,000 people. So we're talking about the equivalent of 2 to 3 major car plants in terms of creating employment in the health research sector. And these are all highly qualified individuals, and many of them are, young scientists in training. And if this economic sector were not available, then our science graduates would go elsewhere in the world to build their careers, and they'd pay their taxes in the US or Europe, and many of them would never come back. They would never, study medicine. They would never become our next generation of entrepreneurial clinicians. They would not be our next generation of scientists, either working in hospitals or universities, or importantly, in the private sector. So we are the farm team for scientists in health research in this country. And that is a huge economic sector.
That's can I jump in again, because that was such a great example from David. But even when you ask the question of, is it not cheaper to buy the latest health innovation? And sometimes no, it is not. And an example that comes to my mind is that within BC Cancer at our Vancouver Island Victoria Center, we are actually manufacturing immunotherapy drugs to treat cancers. So this is when they take your actual blood, you as an individual, put it through a system and actually create these new T cells that are actually targeted for the specific cancer that you have, infuse them back into you. And immunotherapy is showing phenomenal successes for cancer patients, especially with blood cancers at this point. But what's really interesting to me is that a team of researchers on Vancouver Island associated with BC Cancer are actually manufacturing here in Canada those T cells for clinical trials that are currently happening within Canada. And they're doing so at a fraction of the cost of market immunotherapy drugs that are available. So when I say a fraction, these are drugs that available through private sector right now are in the kind of $500,000 per patient kind of realm. And they are able to manufacture them and actually process them in terms of the clinical trials. So including ICU time for patients to receive them and all of that for more like $100,000. So in fact, being a leader in research sometimes actually saves you money in the long term as well.
What a great example. I just want to come back as well to the issue of adopting innovations that are developed elsewhere. So when we do clinical trials, especially with the new classes of medications that are starting to come out, they're complex, and there's very specific requirements for determining who's eligible to receive them and how to monitor patients safely with these new powerful medications. When we participate in those clinical trials, our clinicians and their study teams and our organizations gain experience in the use of these medications. And I can tell you right now, in Canada, Health Canada is reviewing applications for 2 new drugs that actually can affect the progression of dementia. And these drugs were tested in Canada. I know at Victoria, we're again a relatively small city. However, a top enroller in some of the clinical trials, we have been approached. These drugs are, of course, developed through industry, but we've been approached to be one of the initial cities that would have access for our patients to obtain treatment with that drug because of that experience in participating in the clinical trials. There's a lot of training that has to happen with some of these advanced therapeutics. And when we build that capacity in the hospitals, our patients will get preferential access when they're available. That's pending. I mean, there's also the need for drugs to go through formulary review, et cetera. But from the clinical side, that expertise is already there and built in.
So lots of benefits and lots of reasons in terms of why we should be making those investments here. So let's talk about some of the people a little bit more then. I think David talked about how, this is the farm team, for future researchers and scientists in the country. So, and reading from your bio at the beginning, Cindy, and your own personal interest in emerging research in this country, can you describe, what is the impact on, this current research climate and ecosystem has on new and younger researchers?
Yes, and I just want to contextualize as well as an emerging research hospital. So we're not partnered with a university per se to form an institute, but we work extensively on many individual research studies with academic researchers. So I'm going to comment from 2 perspectives, from the clinician side, as well as supporting those academic researchers, which is absolutely critical. So like all areas of human endeavor in society, health research relies on continuous support to build talent, to have an environment that builds and supports talent and career trajectories. So research done for the good of the public now and into the future, because what we learn now can make a difference when we apply that evidence now to address things like the impacts of climate change on human health, for example. That funding landscape in Canada is so competitive that for some grants provided by the Canadian Institutes of Health Research, only about 11% of one grant category called project grants, which are really important, end up getting funded in British Columbia. And although the number is higher in Ontario and Quebec, it's much lower in other provinces. And this still leaves many bright, motivated young researchers with no funding to conduct their research and to develop their careers in Canada. So we mentioned previously the brain drain, that many will end up leaving Canada, taking their bright minds and research potential with them to the US and Europe, where there's a very different funding environment. The other issue that impacts the brain drain as well is the amount of funding provided to graduate students and postdoctoral research fellows. It has not kept up with the living wage for the cost of, well, I shouldn't say living wage, but it hasn't been aligned with the increases in the cost of living. In fact, I saw a quote recently from a master's student in Ontario that received a grant for their 1 year of their master's for $17,500. Now, when I did my master's, and I'm going to age myself, in 1986 to 88, I received $12,000 a year then. So now, 36 years later, that's at $17,500. So $100 in 1988 should be $227 in 2024. So if that funding was keeping pace with inflation, that student would be getting closer to $27,240, which isn't a lot, but it's enough to make ends meet and survive while doing the training. I just want to mention too, so that's the academic side, but from the clinician side, providing protected time for are clinicians that bring their clinical wisdom and experience and knowledge of their patients to conduct clinical trials in the healthcare setting is also an area where we're continually seeking funding and enablement within the health system for reasons that have already been mentioned.
Thanks, Cindy. And yes, recalling my own history as a graduate student, it was, it was fun, but it was, you're eking your way through life, looking for how you're going to balance your bills, and that is a scary proposition in terms of what you're supposed to subsist on. But so yes, I guess I was going to say, so why should this worry me, Ellen? I think Cindy's made part of the case in terms of why I should be worried. But maybe you could build on that further in terms of what is the role of graduate scholarship students and postdoctoral fellows in research, and we've talked about the brain drain and sort of what's going to happen if they leave the profession entirely in Canada. But I guess, what is that gap, or what is that hole? I mean, and what does that future look like without these people?
Yeah, thanks for the question, Dale. I think part of the research landscape and how research actually works that people don't always understand is it is those what we call trainees, those really smart young people with master's degrees or working on PhDs or post PhDs. They are the people actually doing the work. They're the ones actually running the experiment. So, the role often of principal investigators is to be out there generating grants, et cetera. And then they have an experiment. When they get a grant, it is a grant to run a research project, which is a scientific experiment. And it is those trainees who are actually running the experiment and doing the work for that. So if we are losing those best and brightest young people, we're really losing that pipeline of people who are actually going to do the work to realize the benefits that then will be passed on in terms of new knowledge discoveries and patient benefits and all those sorts of things. And David talked about industry, and the reality is those people who get trained in research, those very strong scientific technology experts, they are needed not only in research, but very much in private sector industry. So the economy that Canada wants to develop, where we have a thriving, industry, we need those people to become the workforce of that industry as well. And so if we're not able to support them in Canada as they're learning those things, we're not going to have that pipeline for those people either. And there's just one other kind of quick comment I just want to add as well, is that the money, trying to support those young people is like insanely limited, especially in areas where there's high costs of living, like Vancouver, like Toronto. And the more that happens, the more we also have an increasing issue of inclusivity and diversity. Because if you do not have, say, family background of resources that you can lean on, it's going to be pretty difficult if you can't make an earning wage kind of coming through that pipeline. Then increasingly, you're only going to have people who have the resources of others behind them. And that's going to leave some of those best and brightest people not able to participate. And just think about, the talent that's being left on the table when that's the situation that happens.
Yeah, I think it's a great point, Ellen. And I think it's a conversation we had last year as well on the podcast, talking about the equity, diversity, and inclusion in research, and breaking through some of those barriers. And so, yeah, I think you're right. I mean, I think if you take away some of the economic opportunities for some people, then you are going to be leaving a certain demographic within the system, and it continues to look a certain way. I also appreciate your example around these people are doing experiments, and I guess I would liken it to, in my own experience, I mean, I guess in some ways we're talking about apprenticeship, right? I mean, we're talking about developing skills that will grow into other spaces within our economy and our health systems. And for lack of opportunities to practice those skills, where are they supposed to develop them? We wouldn't treat our plumbers and electricians that way, not give them opportunities to go practice their skills before they have to go and build a high rise or something. So So maybe if I could just move from that then to you, David, to talk a little bit more in terms of what that future needs to look like. I mean, what needs to change to keep this talent in Canada?
Well, I could sum it up in one word, probably, which is hope. So for researchers, trained researchers, they need an expectation that their research projects, have a reasonable chance of getting funded. And as Cindy said, the funding rate for Canadian Institute of Health Research can vary between, 11% or less in some provinces. And where I am in Ontario, it's perhaps one of the better, but it's still a 17% chance of getting a grant funded.
Mm-hmm.
And for comparison, competitor nations, like the United Kingdom, their National Institute of Health Research, their last competition funded at a 35% success rate. So you have twice the chance of getting funded in the UK that you did in Canada. It is soul destroying to write your grant again and again and again and just miss that funding cutoff, even though the peer reviewers say it's a good project, it has the potential to really improve an area of healthcare, and yet there isn't enough money to fund it. It's soul destroying. Remember, the graduate students, the majority of them are also funded from these grants. So if we don't get the grant, that limits the number of trainees we can take on. And then the amount of money that's available to actually pay the trainees, as has been said, is suboptimal. It should not be right that you have to have independent means or generous parents to be able to do graduate studies in Canada. We've had graduate students who have to do second or even third jobs. If you're working at a second job every evening, you're not at your best for doing innovative research during the day. So, as you say, what we would not treat our tradespeople in this way. And yet these individuals are our future in terms of healthcare innovation. So why are we treating them like this? But I started with hope. And I think the system by which we organize health research, certainly at a federal level in Canada, is no longer fit for purpose. The granting councils were put in place, in the 1960s, and the world has changed a lot. And we're lacking a national strategic plan. We don't know where we're going as a country in terms of the vision of the health system we would like. And if we don't have a vision for what health system we really aspire to create, then how can we orientate research to help provide that health system? So we need a national strategic plan for health research and for health, writ large. And when we have that, we can start to generate much more excitement and hope and opportunity for young people to choose to go into this area for their careers.
Oh, it's a great statement, David, and I hope that we do find that hope. But yes, I mean you've made the problem bigger in terms of how much this depends on that vision for healthcare as a whole, and something that we're struggling with in so many aspects of this. So, so maybe Cindy, I mean, building from there, I mean, what does it take to conduct health research in Canada, and who's involved in this? I mean, we've been talking about the funding a little bit, some of these councils and things like that, but maybe you could just demystify that a little bit more for us as well as part of the conversation.
Sure. Okay. I don't know if I can fully answer in the time we have available what it takes to research, given the breadth, but I'll give an overview. So, health research is funded in multiple ways in Canada. So at the federal level, the main funding bodies that support all of that research, from biomedical all the way to health policy research and everything in between, the Canadian Institutes of Health Research, the Natural Sciences and Engineering Research Council, as well as the Social Sciences and Humanities Research Council. So together, those three bodies are called the Tri-Council. So each province has funding bodies as well. For example, in BC, it's Michael Smith Health Research BC. Another area of great and very appreciated support for health research is philanthropy. So there are things like hospital foundations that
Mhm.
whose donors want to see a difference be made in healthcare and health services that donate, and then these large philanthropic organizations affiliated with hospitals. Sometimes they're even associated with smaller hospitals that want to make a difference in their community for health and well-being, or community foundations like the United Way and many more. So we rely very heavily on them, and that's really a partnership between citizens, the donors, the philanthropic organizations, and the research community. So industry, you've heard industry come up several times. The biopharmaceutical, the life sciences industry, they also fund research. So if you think about clinical trials, it's these industry-sponsored trials that offer clinicians the ability to give their patients a treatment choice, as well as advance the standards of care through the development of new diagnostics, as well as treatments for patients. That's critically important. That kind of funding from industry to engage the Canadian health system to develop these new therapies are critically important. If you think of many diseases where there is no cure, those clinical trials bring hope, one trial at a time. And then, sorry, I'm diverging a little bit, but everything is connected with the funding and the impact.
Mhm.
Finally, if I just talk about some of the other funding, our hospitals in Canada have been shifting culture over the last few years to try to support building a solid infrastructure to make it possible for hospitals to be collaborators with researchers and the public to explore better ways to diagnose and treat diseases and provide health services to people. That's also critically important infrastructure. It's like a door is opened to allow research in and to allow the use of that research evidence and innovation into the hospital system.
Thank you. So, it does come down to money at some level, right? I mean, that's what we're talking about here and the impact it has on its people. So, building again from that, then, David, we've talked, or Cindy's talked about the Tri-Council then, so in real terms, like, what are we talking about here? I mean, what is the budget and how does that compare internationally?
So the budget for federally funded research, not just health research, but other research as well, and it's more than just the Tri-Council. There's a number of other agencies that the federal government invests in. But put it all together, it amounts about to $3.8 billion a year. Sounds a heck of a lot of money, but it actually equates to about 1.7% of Canada's GDP. And that actually is pretty low compared to our competitor countries. So if you look at the top 7 OECD countries, their average investment in research compared to GDP is about 2.7%. We're stuck down on 1.7%. The US leads the pack. It invests about 3.5% of its GDP equivalent into research. So we're actually bottom of the pack. Of the top OECD countries, I think in 2020, we only Italy invested less than Canada, and by 2024 we're probably below Italy as well. It's even more worrying because Canada does not at the moment seem to have a plan for increasing that investment, while other competitor nations do. So the US has committed $81 billion in funding going forward through the National Science Foundation. Germany set a goal of spending 3.5% of its GDP on R&D by 2025, so to match the US. And the UK, as openly says, they want to become a science superpower. And they're going to increase research funding by £20 billion by 2025. So other countries are really recognizing that they need to heavily invest in research and development in every sector. They never want to be caught in a COVID situation again, where they're not in control of their own, health destiny. Canada does not seem to have received that message yet, or at least is not translating that into intent for reinvestment. So how do we turn it around? Well, the government's own Standing Committee on Science and Research recommended late in 2023 that the Tri-Council budget be increased by 10% every year for the next 5 years. That would just really turn the direction back into a positive from, at the moment, it's negative. Because with high inflation, we actually have less money every year at the moment to spend on research. So that standing committee approach would cost just over $4 billion over 5 years, but would at least turn us back in the right direction. We'd still be well behind our competitor nations. So to actually get back, for instance, to that sort of 3.5% of GDP that the US invests and Germany aspires to, we would actually have to double the budget of Tri-Council. And that actually is the recommendation from Healthcare Can, that we need to double the budget to get back even to where we should be in our competitor nations. And only by being competitive will we keep our talent in Canada.
Yeah, well, even in preparing for the conversation, I was just curious in terms of what like for-profit companies invest in R&D, right? And it's kind of staggering. I mean, in terms of the biggest companies are on the stock exchange, like Facebook or Meta, right? And Amazon's spending like $20 billion a year, 20 billion, like compared to what you've just described here, right? For a company that's certainly trying to diversify, but they clearly understand the importance of research as a mechanism for growth and survivability even. So, so maybe Ellen, just building for that again, continue on this conversation and building this narrative. What are some of the real world consequences of this federal funding shortfall as has been described?
Yeah, I think it's kind of reiterating some of the things we've already been talking about. So it is that chilling effect in terms of the pipeline, right? In terms of those best and brightest young people, and it is sort of human capital that every country really relies on to grow its economy. It's the inability to keep and train and retain those people in Canada. It's the inability to retain established researchers with established programs of research in Canada. So then it's the loss of good tax-paying, well-paid, contributing taxes, jobs that create the fabric of our cities, et cetera. It's the loss then of access to innovation and new technologies through clinical trials that should be being done here in Canada. It's the loss of access sometimes to those clinician investigators who may be, almost solely responsible for highly specialized clinical programs, where if we can't keep them in the country, then they go too, and there goes like a whole clinical program that Canadians lose access to. And it's David mentioned this in terms of like needing to control our own destiny. The pandemic really showed us the importance of research. The mRNA vaccines that got us out of the pandemic were not things that we did research on when the pandemic hit. These were in the pipeline for decades of research and what we call investigator-led research. So those PIs that actually advancing the areas of their interest and passion, that's what led us to mRNA vaccines. That's what enabled us during the pandemic to quickly turn what could have been, a much more global crisis into something that was managed, relatively quickly in terms of that. There's going to be another pandemic. This one might be a lot more lethal. Do Canadians want to be 100% reliant on other countries? We see what happens in a crisis. The drawbridges tend to get drawn up if we cannot create our own solutions, if we cannot manufacture those solutions, which again requires that highly specialized workforce, then we're going to be completely reliant on other countries. And I think history shows us what happens when we do that. So, there are many, many implications. There's a lot of interdependencies on them. But again, it comes back to that strong, healthy health research ecosystem is a fundamental underpinning of a strong, healthy economy and a strong, healthy population. And that's why we need to keep it thriving in Canada.
So maybe just before I come to a final question, and turn it loose on all of you, just sort of to talk about our future, you know, a lot of this, research I think that's been described is, and I think as you set it up at the beginning, Ellen, is that, this is happening in association with research hospitals that are largely in our large urban centers. You've talked about it a little bit, Cindy, but maybe just describe what that looks like in not the largest centers in Canada. What is their ability to conduct research, and how does it look different in some of those smaller centers like Victoria or Nanaimo?
Great, thank you. So Ellen touched upon the COVID-19 pandemic, and I will often say that the pandemic shone a neon green light on the challenges faced in delivering the best quality healthcare possible to the patients that we're here to serve in the health system in a pandemic. And Ellen is absolutely right. The next pandemic will come. There was a lot of learning around the clinic. I'll talk about clinical trials right now, but then add a few other areas too. There was a lot of learning about clinical trials and the patchwork of infrastructure that we had across the nation. In a pandemic, it's more than the large teaching hospitals that are admitting patients for care. It's the community hospitals and hospitals in mid-sized cities like Victoria across the country. A lot of very compelling publications have come out since then, and our government has responded through programs like the Accelerating Clinical Trials program that seeks to build that essential clinical trial capacity in a sustainable way in community hospitals. So, and critically important for not only COVID, but if we want to accelerate the development of innovations in diagnosis and care in Canada for Canadians, we need that robust presence of clinical trial capacity across hospitals, large and small, across our country. If we look at, and we can never forget that we have brilliant physicians and clinicians that are working across our healthcare system in centers large and small. And sometimes in the small centers, I have seen research enable innovations in care that would never have been possible without putting together research funding from various sources. An example is spasticity. I'll just give a practical example. People that have experienced stroke or other neurological conditions can have very, very painful spastic muscles where not only are they in pain, but they can't move. A local physician in Victoria has developed a new strategy for releasing the nerves that are causing that damage. And that therapy has now spread to Harvard and Oxford and Paris, and he's published books, and it's spreading across the world. It's something that it doesn't have commercial value, but it's impacting care across Canada and globally. And it came from a small center that had some infrastructure to support a highly motivated clinician who wanted to make care better through research. There's many examples of that across Canada.
Yeah, and I think that's it's important. I think that we hear that research comes in all sizes and has significant impacts in terms of its totality about so many aspects of our care continuum. So thank you for sharing that as well. So maybe just sort of as we come closed and wrap things up, a question for all of you, and maybe taking on your question for us all, David. I mean, what does hope look like? I mean, what would a well-rounded, world-leading health ecosystem in Canada look like, and how do we build it? What will it take?
Well, an appropriate level of investment is important, but it's not all about money. We need a plan. First of all, we need to be facing in the same direction and understanding what Canada wants. as goals for the sort of health system that it aspires to. And then we can orientate ourselves to those wicked problems and put together the research teams that can tackle them. But it also needs our ability to share information. Health information in this country is horribly siloed between institutions, provinces, researchers. We need to be able to share that information, and particularly research information, because we are very, very, very good in this country at forming research teams. You don't see this in other countries. In the US, even investigators in the same building can be in competition and not share any data. You don't find that in Canada. We work as teams, and we need to be able to share data to be able to form effective teams. And then finally, integration of our funding partners. Yes, the federal government is an important anchor partner in research, but it's not the only one. As Cindy has said, there's the provincial governments, there's health charities, there's local philanthropy, there's industry. And we need to bring them together so that they start to synergize in what each can bring. And I'll give you a practical example of how that's not working. So I'm a diabetes researcher. If I want operating funds for a diabetes project, then I need to write a grant to the Canadian Institute of Health Research. But if I want equipment to use in that project, I have to go to a different agency, the Canada Foundation for Innovation. And I know I'm never going to get enough money from the Canadian Institute of Health Research to actually do the full project. So then I'm going to have to write another grant to Diabetes Canada or the Juvenile Diabetes Research Foundation, or go to my local hospital foundation and ask for philanthropy help. I'd end up writing numerous grants, all with different submission dates, all with different submission documents. I spend more time writing these applications than I do doing the research. And yet it's all the same program of research. So why can't we all get together, all of the numerous stakeholders that contribute to health research funding, and so that our best scientists put forward a program of work, it's peer-reviewed appropriately, but then partners buy into that so that the scientists can get on with our work and not keep writing grant after grant after grant.
Thank you. Yeah, and I'm thinking in the example you provide that if any one of those parts doesn't come together, you're left with a very uncomfortable sort of place in terms of figuring out how to bridge that.
Yeah, so it's unfulfilled potential. We have huge unfulfilled potential in our health research sector in this country.
And the only little piece I would add to that is just, I do think Canada has the potential in terms of bringing a world-leading health research ecosystem to also be a leader in integrating the health system and the health research system so that we actually do a much better job of actually implementing the results of new knowledge into the system of care to improve outcomes. I mean, that is a tough thing to do. Nobody around the world does it really, really well. But I think Canada has some of the ingredients to be able to do it quite well. And so that's another aspect of health that is really, to me, sort of the, what we're really all aiming towards is actually being able to harness that discovery and implement it to realize the benefits that it promises.
Mm-hmm. Yeah, that knowledge translation.
Well said.
Yes.
Just to add to that, Ellen and David, I also see to create the type of health research, health system of the future, that we see a continuation of that culture shift that recognizes that health research is part of the core work of the healthcare system, that we have the infrastructure and the connections and the partnerships and the funding to continually look at how we're doing and what the outcomes are and can we do it better. And we're involved in the generation of that evidence and innovation, and also, so importantly, the uptake, the accelerated uptake of that evidence and innovation into patient care.
Wow. So this has been a phenomenal conversation. Thank you, all three of you. for an hour of education that's been really very rewarding for me in terms of better understanding myself, in terms of the role that health research plays in our country and our health systems. I mean, you've built a compelling case in terms of how it touches all aspects of both healthcare and society as a whole, in terms of how critical this is to our economic development, our growth as a country, to our national security, right, to the future scientists that will become, other leaders in many aspects of our system, and to our patients and families and communities and cities around the country. So there really is no part of, I think, that the things that we take for granted, that health research doesn't really play an important part of. So thank you for helping us all to see that. And I hope that it does inspire hope at the end of the day, David, for change in this country. So much needed.
Thank you, Dale.
Yeah, thanks. It's been a lot of fun. Thanks very much.
You've been listening to the HQ, and I'm Dale Sherback, your host. You can find this and other future episodes on the CHA Learning website, Apple Podcast, or Spotify. We'd love to hear what you think, so please follow us on our other social media channels. Thanks for joining us in this discussion today. Please join us next time.